So you might be interested in hormone replacement therapy for all the benefits that it can give you. But what if you have a strong family history of breast cancer? What are you supposed to do then? If that's you or someone you love, this video is for you or them. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. Let's dive in. What to do about estrogen replacement therapy if you have a strong family history of breast cancer. Here's some statistics and some studies that you need to be aware of. The E3N cohort study looked at over 80,000 women on hormone replacement therapy, and they found that the most important factor of hormones and breast cancer was the progestin in the combination. Please know that I hate that word progestin. It's not really a hormone. The true hormone is progesterone. But the issue is a lot of the formulations for hormone replacement out there don't use progesterone. They use a progesterone-like chemical, and they've named it progestin. There is no progestin hormone. They're calling medroxyprogesterone acetate, drospirenone, all those things that are in birth control pills. I can't rattle them off at the top of my head, but those are fake progesterone. They act like progesterone only on the uterus, and on the breast, they have a completely different action. In fact, in that E3N study, it was the progestin component that's made the difference, because women who are on estrogen alone, the risk of breast cancer was 1, meaning no higher, no lower. But for women who were taking the estrogen plus the medroxyprogesterone acetate, it was almost 1.7 relative risk of getting breast cancer, which is an increased risk. So the progesterone that you use matters. Why not use it like God made it in the actual progesterone form? It's available. It's easy to get. It's not expensive. It's not rocket science. Use the bioidentical hormone. Just because you have a family history doesn't mean estrogen's completely off the table. It means you need to have a nuanced conversation with someone who understands the risks and benefits of hormones and all the factors that relate to cancer. One thing that we do know affects estrogen safety is how it's metabolized. Let's talk about that a little bit. Estrogen has a job to do in your body, and then your body needs to get rid of it. That's estrogen metabolism. The hormone does its job, and then you're supposed to get rid of it. Excrete it. Get it out of the body. So there are different pathways that your body can get estrogen out. And so there's a 2-hydroxy pathway, which is safe, and there's a 4-hydroxy pathway, which is not safe. It has to do with the chemical reactions that happen to estrogen after your body uses it and as it's getting ready for disposal. I call the 2-hydroxy pathway the happy estrogen and the 4-hydroxy pathway the unhappy estrogen. And if you have a lot of unhappy estrogen, even if you're on bioidentical hormones, it can be a problem. The 4-hydroxy pathway leads to inflammation, and if it's not handled appropriately, it can lead to something called quinones, which damage DNA. And damaged DNA, without the ability to repair it quickly enough, is what leads to cancer. We need to check this. This is done with a urine hormone test. The only way we know how your body is excreting estrogen is by checking your urine. Blood, saliva does not work because it's not getting the estrogen metabolites. We have to get them in the urine. So in our practice, we use the Dutch test. The Dutch test will give us information like the 2-hydroxyprogesterone, the 4-hydroxyprogesterone. How will you methylate? Methylation is the second component of estrogen metabolism, and we need to be able to methylate to get rid of our estrogen. Another thing that is important is something called beta-glucuronidase. So beta-glucuronidase is a chemical secreted by rowdy bacteria in your gut. What this does is it allows estrogen to disassociate and recirculate. You don't want estrogen recirculated. You want to use it and get rid of it. But beta-glucuronidase creates a little revolving door in the gut where you're trying to get rid of it, but it disassociates and comes right back in. So the way to know if you have abnormal beta-glucuronidase is to do a stool study, and it can be measured. That's another thing we will do for patients in our practice. If there's a strong family history of breast cancer, or if there's concerns for estrogen dominance, that may be a good test to add to the Dutch test. There are things we can do to improve our estrogen metabolism. Things like diindolylmethane, also known as DIM, which is the active ingredient in cruciferous vegetables, is very beneficial for improving the 2-hydroxy pathway. So the 2-hydroxy pathway, remember, is the happy estrogen. If we increase the happy estrogen, then that leads to a lower 4-hydroxy pathway by default because there's this much estrogen. And if you're increasing the piece of the pie, that's the 2, you got to decrease the piece of the pie, that's the 4. So those are things that we can do to improve estrogen metabolism. If you're concerned about beta-glucuronidase and estrogen recirculation, fix the gut. Get rid of the rowdy crowd, eat the fiber, eat the good foods that the gut likes. You can do a microbiome stool test to evaluate. You can also take a supplement called calcium D-glucarate, which blocks the beta-glucuronidase enzyme, and it doesn't allow the estrogen to recirculate. So there's some simple things that can be done to improve this. So you see, there's so much more involved than just get your mammogram every year and don't take estrogen. There's so much that we can do, and I want to talk about those things with you. Let's keep going though. What if you've made the decision that you don't want to take estrogen? Are you at a loss then? Is that just means you suffer through it and you're going to be hormone deficient for the rest of your life? Actually, no. And that's good news. There's a lot of information out there about testosterone, and testosterone can give a huge improvement in the quality of life for women who are not taking estrogen. And it protects the brain, the bones, the muscles, similar to those benefits of estrogen. We don't think it helps with the hot flashes as much, but all the other benefits it can certainly help with. And we do know that testosterone can aromatize, which means turn into the ring structure and become estrogen. For women that are really interested in avoiding the estrogen altogether, we use an aromatase inhibitor. In our practice, we like to use pellet therapy for this because we can give a testosterone pellet and a teeny bit of aromatase so that it doesn't cause all the muscle aches and things that higher dose aromatase does, but it does prevent the testosterone from aromatizing into estrogen. There's some studies out there by a doctor out of St. Louis actually looking at women, not just with a family history, but with a personal history of breast cancer. And in those women, she used testosterone pellets plus anastrozole and had no increased risk in breast cancer and massive improvements in quality of life. So that's a consideration. Talk to a doctor that knows how to prescribe testosterone in women's doses, which is not 1/10 of a pump of a man's dose. The other hormone that is a potential for you is progesterone. Real, bioidentical progesterone, not medroxyprogesterone acetate, not drospirenone, not any of those fake progestins. Real progesterone. Real progesterone is calming. You take it orally, it acts kind of like GABA, gamma-aminobutyric acid, which is a calming neurotransmitter. Take it in the evening and it can help you sleep better. Most women in menopause don't sleep as well as they used to. So I love to use oral micronized progesterone to help them sleep better. So there are things that you can do besides just estradiol. If you are really struggling and you've made the decision, not out of fear, but an informed decision with a full conversation with a knowledgeable provider about whether progesterone is for you. Now, what if you have a high risk based on your family history and you decide you want to do hormones and you want to do estradiol? What should be done then? Well, for sure, let's monitor you, and the monitoring starts at home. Do your self-breast exam in the shower or laying in bed. I like the shower because the water on your fingers makes it slide easier, and it's easier to get a feel. You're looking for anything that feels like a pea, a pebble, a piece of sand, something different than what it used to be. And if you do this every month, you're going to be so much better at recognizing changes than a once-a-year exam with a doctor. Okay, what about imaging? Get your imaging done. Should you get a mammogram? Should you get a mammogram plus an ultrasound? Should you get an MRI? Those are things that are traditional recommendations for people with high risk for breast cancer. There's also QT imaging. QT imaging is speed of transmission through tissue, as well as ultrasound, regular reflective ultrasound. There's no radiation. There's no compression. There's no IV contrast. There's no heavy metals. It's safe. It can be very helpful for women with a strong family history who need more frequent imaging. Look and see where there's a QT imaging center near you. We have one in my practice. I'm so happy to be able to offer this to women. And then once you're on hormones, right away, get the Dutch testing. Now, if you're not on hormones and your hormones are super low, a Dutch test is not going to be that helpful because you're trying to dissect the makeup of something the size of a pinhead. If you're trying to decide how big the pieces of the pie are, you need something a little bit more than a pinhead. So what I will do in that case is I will start the woman on hormones, and by month 3 or 4, when we've gotten the hormone levels up a little bit so that it's easier to measure the breakdown of the metabolites, then we'll do the Dutch testing. That's the urine testing that looks at 2-hydroxy, 4-hydroxy, methylation, evaluating the balance of estrogen and progesterone, as well as how do you excrete the estrogen. Super, super important. Make sure if you're taking hormones, especially the estrogen component, don't take it orally. That increases inflammation, and inflammation is one of the risk factors for cancer. How does this work? When you take a pill, it gets digested and absorbed through your gut. There's a little blood vessel called the portal vein, and things absorbed from the gut into the bloodstream go right to the liver. So it doesn't go through your whole body like your ovaries used to secrete it into your bloodstream and it would go through your whole body. It goes from your mouth to your gut to your liver. And in the liver, it increases inflammation. And these inflammation things are what increases the risk of heart attack and stroke and birth control pills and oral estrogen. Inflammation is also one of the drivers for cancer. Don't take anything that increases inflammation. Don't take oral estrogen. Oral progesterone is different. It's not mutilated by the liver. In fact, it's in the liver that you get that 5-allopregnenolone made, which is the GABA-like neurotransmitter substance that causes the calming and the improved sleep. So estrogen, estradiol, hormone replacement therapy should be a cream or a patch. And progesterone, micronized oral progesterone. Testosterone, again, not oral. And in this case, it would be either a pellet or a cream. There's no patches in women's dose. So now I want to go back to the woman who commented and asked what to do with a strong family history of breast cancer. What you need to do is you need to have a conversation with someone who understands and is willing to explore your risk. Not just a blanket, no estrogen, and not just a blanket, get more mammograms. Let's look at all the things that we have control over and evaluate what do we have control over that contributes to cancer, and what can we do to decrease our risk? That's the most important question. I hope this has been helpful for you. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. I'd love to have you subscribe to my channel. If I can help you, reach out. If you want to take my hormone quiz to know if you have hormone imbalances, please follow it. It's in the link below. And if you know of someone who needs to hear this information because they have a family history of breast cancer and they're wondering if hormone replacement therapy is right for them, forward this to them. Thanks a lot. We'll see you next time.